Hey there YouTube, Dr. Carlo here from ED Video. I just got doing a really cool procedure. It's been a long time evading me. Last time I did this, I didn't think to record it because it's usually difficult to do. It takes a few attempts and I just didn't want to do it. This time I said, well, let's give it a try, and it was so awesome. It was successful. I didn't have to sedate, I didn't have to numb the guy. Basically, it's an older gentleman that about once a year gets this problem where he's opening his mouth too big and basically gets a locked jaw, a jaw dislocation. There was no trauma, no fall, no injury, so I didn't do any x-rays. He's an older guy, so I didn't want to do any sedation. He has history of hypertension or the medical problems. So I just essentially did manipulation with traction and it came out. It went well, so I hope you enjoy this video. See you next time. I'll just get it started.
Okay.
We'll talk while I get ready and stuff. And you can talk on it, so that way people get the education. So this happened a few hours ago then?
Yeah, I'm guessing around 2 o'clock. My wife left and came back, and he said my jaw was locked up. And I was just leaving work, and I work all the way down in South Atlanta. So I drove here as fast as I could, because I know he's uncomfortable. And I kind of worry about his blood pressure and his heart and stuff.
Of course. So we haven't sedated him or given any pain meds or anything. We're gonna give it a try.
Okay.
If that doesn't work, there are a couple options. We could do an injection of lidocaine near the joint, and that will release the muscle. That would, okay. Yeah, just keep it going.
Okay.
Because I'll do the editing later.
Okay. Gotcha.
So what I'm doing is I'm covering my thumb, because once it finally does reduce, then the patient can reflexively bite on you.
Yeah.
I'm just protecting myself. I'm going to put this back. Can you sit back on this? Good. And then just tilt your head towards me. Come a little closer like that. Okay. Go back here. I know it hurts. I'm not doing anything just yet. Try to relax. Maybe I need to be a little bit higher.
Okay, so wait a second, we got somebody on the stretcher.
I'm not doing anything right now. It's starting to move. Hold on. I just need to get higher on him.
You got it.
Like a little. Oh,
You got it.
huh?
Yeah. Okay.
That's all there is to it.
Yeah.
Right?
Yeah.
Did you learn enough to do it yourself next time?
I could almost do it.
All right. Let me talk to you a little bit. Put each thumb at the angle of the jaw. So, you know, him having no teeth there kind of got me for a little scare. So you put your thumbs in there and you start putting some pressure downwards. And then usually you feel a click, and we did. I felt a click, but I didn't think it was in there. I thought it just moved a little. We call that subluxation, when it moves in position. And then that's that. Sometimes that doesn't work, and you can do something called relaxation. You can take tongue blades. We do that usually in younger. We do this in younger patients. So you take tongue blades like this,
Yeah.
and you start putting them in until you can't fit anymore.
Yeah.
So by hiding them in your mouth like that, you leave it about 5 minutes or so, and then you take them out, and the muscles are so relaxed, it just falls in.
Huh.
That's another technique of doing this. So basically, you're opening the mouth enough to stretch the muscle until it's fatigued, and you leave it in for 5 minutes so the muscle's all tired from being stretched out.
Yeah.
And then when you take it out, the muscles contract and it reduces itself. So that's another way to do this.
Okay.
Thank you. It's my pleasure. I love doing this.
Thanks. Appreciate
So no sedation, in and out.
Yeah.